So I'm super excited to introduce Dr. Joseph Martin, coming in from San Antonio, Texas today. Yeah, and we've had the chance to meet over the past few months and finally in person yesterday. And this is the son of a 43-year career NICU and labor and delivery nurse, which I will say probably inspired you to go into medicine. And first you trained in family medicine, and then you fell into the opioid epidemic in Northeast Tennessee and trained in addiction as well. And then, just to add on another layer of training, he decided to train in emergency medicine. And so he's been in practice for over 9 years, specializing in family, addiction, emergency medicine. He's practicing currently at UT Health San Antonio, clinical faculty there in the emergency medicine psychiatry department. But this guy's not just in Texas. I mean, he's taking shifts in Wyoming that struggles to have a very strong healthcare system, and he's doing that. He's oftentimes on shift alone, taking care of folks. He's taking shifts in Virginia and Tennessee, New Mexico. So it's kind of the doc of all the places. So super excited to learn from you this morning about ACEs, adverse childhood experiences, trauma, the interloop between addiction and trauma. And so I'll hand it over to you, Dr. Martin, to take us away. And I'm going to step off stage as well.
Thank you, Dr. Recker. So I am much more comfortable in a trauma bay with sick and dying people. This gives me a lot of anxiety, so bear with me. I've known Jason for about 4 years now, and we've worked on quite a few projects together, and it's a privilege to work with him and continue to work with him and to address you guys today. What I'm hoping is that as I go through this admittedly dense material and try to make it interesting and try to make it memorable, you're able to connect the dots and see how functional biology, functional physiology manifested into real behavior. Jason, I think, will connect with a lot of this, and if you do and you want to share something personal, please feel free to interrupt me. I'm used to educating medical students and residents, so if you have any questions, just shout them out. Truly, you're not going to disrupt or interrupt me. But to start off with, so the modern view of addiction as a disease, we knew that there was a biological and genetic component. There was only so much that could be done about that. Then we knew that there was a psychological and socioeconomic component that we come towards and will evaluate with ACE scores. And then, of course, there is use and exposure. We know that those variables come together. There's a brain switch, if you will, and then the development of addiction occurs. So I get asked all the time, what's the difference between casual substance use? I have a drink with my wife or my husband when I go out, a glass of wine, but I don't struggle with addiction. I don't get that. So I'm going to help. Thank you so much. I'm going to help to try and illustrate specifically why these things happen and what transitions that takes us from casual substance use or exposure to casual substance use or exposure to ideas, and then ultimately transitions into addiction. So this is the pleasure-reward pathway, the mesolimbic system. In the front is the prefrontal cortex. So I have the luxury of working with students whose prefrontal cortex is fully developed. For men, it's a little bit later. For women, it's a little bit earlier, but it's about at the age of 25. So what does the prefrontal cortex do? As you have probably noticed, sometimes very frustratingly, in your students' impulse control. That tends to be where your prefrontal cortex will really put the brakes on impulsive decision-making or poor decision-making or poor coping mechanisms and skills. So that it can be very challenging when you're working with younger patients or working with younger students because their prefrontal cortex, their brake pedal with regards to their impulse control isn't fully formed. But the nucleus accumbens is where everything really starts. It's where dopamine is produced. Dopamine is the currency of the mesolimbic system. And the ventral tegmental area is where dopamine really starts to have its special effects and what we'll get into. This next slide is going to talk about exactly what dopamine is as far as a currency and how it can be so influential and how it can be so overpowering of the brain. And bear with me, I know this is dense stuff, but the nucleus accumbens is the center of the mesolimbic system, dopamine currency of the system, as we said. So if you wake up in the morning, you've done nothing. You haven't had coffee, you haven't reached over and kissed your loved one or pet your dog, you just literally open your eyes, you're at 100%. So if you assume that the best meal you've ever had, not McDonald's, but grandma's cooking, grandpa's grilling, your husband's grilling, your wife's cooking, whatever it is that like really takes you home and feels like home, that is 150% of your baseline dopamine. So you go up about 50%. That's a normal human interaction I would bet that everybody in this room can relate to. So the most healthy sexual relationship that you'll ever have is about 200%. So that's a normal human function that most people in this room can relate to. Morphine is dose dependent and peaks at about 10 milligrams per kilogram, which is standard dosing for pain. So if a patient comes to the emergency department, they've broken their leg, 10 milligrams per kilogram is not an unreasonable dose for me to treat them with for their broken leg. It's about 200%, but can fluctuate up to 300 to 350% depending upon genetics. So nicotine is about 225%, can fluctuate up to about 325% depending upon genetics. Ethanol, 200%, can fluctuate as much as 400% dependent upon genetics. Cocaine is around 325%. Amphetamine is around 1,000%. So I want to take a moment to really hone in on that. That is 5 times more potent than, in theory, the strongest, healthiest sexual relationship you'll ever have. It's foundational, and it's why it's so challenging to get patients that struggle with substances off of substances. Methamphetamine is hypothesized to be much greater than 1,000%, and social media falls somewhere in there. There's the positive affirmational social media, whether it's the community that you build, whether it's a church group, whether it's volunteering, whether it's sharing pictures of your grandkids. And then there's the less affirmational form of social media that tends to push teenagers and even adults to buy things that they don't necessarily need or feel as though they need to present themselves in a specific way, dress a specific way, or engage in certain activities just for that affirmation, that like. But whenever we discovered this, and granted, this data is old. We've known this for a long, long time. And this totally changed the paradigm of how we provided therapy to patients that suffered with addiction. Initially with morphine, with nicotine, with ethanol, you could counsel these patients and be in therapy with these patients and convince them like you could get back to normal, healthy sexual relationships. You can get back to normal, healthy meals and interactions with your family around the dinner table. Like it's reasonable that you will have a similar experience to what you were having before. Whereas with methamphetamine and amphetamine, literally we had to tell them you're never going to experience anything like this ever again. But if you don't stop, you're going to die. That is a huge weight and a huge barrier to move past, and quite frankly, very depressing. But it can be done, and social media is the same way. Regardless of how much dopamine children or adults are getting from this, you can rebuild a community and a connection with intimacy and with self and with family, faith, that pulls them back away from that and redevelops their identity to understand why it's so important to have a sense of self and community outside of social media. All right, so this is where it gets kind of dense, so truly stop me if there's a question. We talked about the mesolimbic system, which is the reward pathway. This is the habenula, which is the anti-reward pathway. So this is the brake pedal when it comes to dopamine. Loss of a reward or suddenly experiencing a sharp pain activates your habenula. When you have disappointment, you don't simply not feel a reward, you actually feel a sense of loss. Said differently, your 100% baseline dopamine that I said when you wake up in the morning and you open your eyes actually decreases to 75% or more. So who in this room has heard of ACE scores? Good. So then I will be reviewing some of this, but hopefully there's some new tidbits. This is actually the most informed room I've yet seen with ACE scores, and I'm thankful for that because this is one of the most powerful studies that we have that the average person is not familiar with. But it was published by Vincent Folletti. He was out of Kaiser Permanente in 2004, and it demonstrated a graded dose-response relationship between adverse childhood experiences, aka trauma, as well as negative health and well-being outcomes. But this was correlated in a dose-dependent manner, i.e. more negative interactions, more trauma, more likelihood of bad outcomes. And it was correlated to diabetes, high blood pressure, homelessness, premature death, depression, educational achievement, income, cancer, IV drug use, you name it. So these are the ACE score questions. I won't read them to you, especially since you're familiar with them. I post them because I think it's a good conversation starter, and I like frankly to get people to think about very uncomfortable things. My personal ACE score is 6. I'm not embarrassed to admit that. And I think it's important to be reflective and open and honest about what you yourself have dealt with, where you're coming from, but also reflective and responsive of where your patients or where your students have come from. And this can paint one hell of a picture in helping to understand why their decision-making processes are the way that they are, and frankly, a lot of empathy. So there was a 250% increase in the likelihood of an ACE score 6 child being a current smoker as compared to 0. There was a 500% increase in adult alcoholism related to ACE scores in a strong, again, dose-dependent manner. Another example, a child with a ACE score of 6, much like myself, had a 46-fold or 4,600 increased risk of being an IV drug user. Every time I see patients in the emergency department or in my addiction medicine clinic, I think about every single time that could have been me. And it humbles me, it gives me patience that I need to work with these patients who are extremely frustrating at times. But it's important because it's real and the statistics are real, and the roles very well could have been reversed. So what is dopamine exactly? It's a neurotransmitter, but why does it matter? So this is probably the most important slide. And this is really where I want Jason and Ashley to kind of think about how addiction transpired throughout your lives, and you can connect with how this happened and played out in real time, the functional physiology and biology. But you have the mesolimbic system. When this is predominant, you have a system that is overpowering the habenula, the brake pedal, the anti-reward center in the brain during early exposure to trauma or early exposure and development of addiction. Self-medicating and or the pursuit of high. You still enjoy the risk-taking behavior. You still enjoy the substance. You still enjoy the gambling. The saves outweigh the risk and outweigh the trauma exposure because the highs are still there. Eventually, over time, the habenula finally takes over and says, wait. This is not evening out in the wash. Like, we're losing a lot more than we're gaining. And with chronic exposure to trauma, the anti-reward system, the habenula, overtakes the mesolimbic system, and it becomes less frequent. The wins become less frequent until they cease altogether. As poor coping skills progress and habitualize in the nucleus accumbens, coping mechanisms morph into the pursuit of the pursuit of reward into avoidance of definite pain and loss, and attempting to simply regain that 100% baseline of dopamine that normal healthy people wake up with every single day. Saves no longer outweigh the risks of trauma. Burnout develops, you get less effort, and you're quote unquote just trying to survive, just trying to make it. Reset of the dopaminergic baseline goes from 100 to 50 to 25, all the way down to approximating 0%. As poor coping mechanisms get worse and worse, and you become more and more identified with the trauma, with the addiction, it becomes your identity. I once had an alcoholic explain to me, the difference that people don't understand about alcohol is alcohol gets me. It doesn't argue with me. It's like a warm hug. It's always there. It always affirms me. It always tells me I'm doing the best I can. Those are all personifications that you should be giving to a human being, even your dog, let alone a substance. And that is the most uncomfortable aspect, is that addicts form a relationship, an identity, a community with the substance, with the problem, or in some cases with social media, and they become so enveloped in it that it becomes an inescapable version of themselves. In fact, it overtakes every other version of themselves. That is the very basis of addiction, the absence of community and belonging and identity with anything else other than that singular thing. That is the difference between casual social media use, casual alcohol use. It's not your identity, it's not your community, but there is a point where it transitions over and that's all you can think of. It's all you can identify with. It's all that you can personify. You know, the people online, they get me. They like me. They're there to listen. They're there to care. They understand what it's like. Not the people at home, not the people at school that care about me, not my professors, my coaches, my teachers. That is the transition point. So you go from living for the weekend, miserable all week, to try and party on the weekend until even the weekend isn't enjoyable. Risk-taking escalation is seen in gambling, greater and greater risk in an attempt to regain your baseline, in an attempt just to get back to zero. Psychology often will overpower common sense. That is the whole basis of the pathology of addiction. This is a graphical form. I like pictures. This helps to make sense of a very dense topic. But that happens in real time over time. That is why you have an increase in tolerance and an increase in risk-taking behavior and an increase in consumption. Nobody really becomes an alcoholic off of one shot, but that's how it starts. Nobody really becomes addicted to social media off of one like, but that's how it can start. And that dose response curve from ACEs explains why this behavior happens out in real time, in real behavior. This is something that I like to go into because it helps to rationalize and understand why we have this system in the first place. The dopamine system exists evolutionarily for a reason. You like food. You're supposed to like food because you're supposed to eat to maintain your life. You're supposed to want and crave water. The problem is we got so good at hijacking that dopaminergic system in the form of social media, in the form of gambling, in the form of substances, to the point where we took advantage of that consumptive model to a pathologic degree to where it can completely overwhelm your ability to think about anything else. In a wholesome way, you have saving for retirement, so to speak. When you engage in a dopaminergic activity like music, like art, like interacting with your family, walking your dog, throwing the football with your kid, cooking with your family, engaging in your church, your spirituality, whatever that is, however that is, you're developing a relationship. That was the purpose of dopamine all along, to develop a connection and a relationship. When you're counseling students, when you make a breakthrough, you see that aha moment in their eyes. That is dopamine. That's what makes you come back to work every single day to work with students. That's what comes back to work, makes you come back to work every single day to work with those patients. It's that aha moment. That's the whole purpose of dopamine. And when you're engaging in those wholesome, i.e. productive processes, you're building something, you're producing something. Sometimes that thing is art, sometimes that thing is music, sometimes that thing is a relationship, but it inherently is tied to growth. You are growing in some way, whether you're growing in proximity to that person, to that idea, to your faith, to your family, to your dog, to developing a skill. You're growing something. Whereas on the negative aspect of things, you end up having a more consumptive process. Sugar is the classic example of that. So critical self-evaluation is what I work with and teach my patients. If there is ever a point where you are more protective over the thing that is potentially of concern than you are of your relationships with yourself, your relationship with your faith, your relationship with your family, your professional relationship, your scholastic relationship, your relationship with athletics, if you become more protective of the thing that is a potential problem, then that's a sign you have a problem. Do I drink too much? Do I work too much? Do I spend too much time doing whatever? Do I go through the motions too much? Am I too angry? If these questions make you uncomfortable, that is the first sign that there's a problem. Especially if it's coming from someone like your husband or your wife, or like your pastor, or like your teacher or your coach. That should prompt the question of, why is somebody that I trust asking me a question and it's making me frustrated, it's making me angry, it's making me defensive? At the crux of all of this is all a problem with intimacy. Ashley and Jason's relationship improved when they improved their intimacy, when they improved their openness, their sense of community, talking to each other, engaging with each other in a way that was productive and constructive. But what therapists do, what educators do, what professors do, what physicians do, is you are the piece that takes an uncomfortable situation and is the difference between a productive conversation and a destructive conversation. Because we all work with a challenged and troubled population. We all deal with those challenges personally. We all deal with those challenges professionally, sometimes spiritually. Whether it's in your marriage, whether it's in your classroom, whether it's with the people that work for you or the people that you work for. The whole point is to deal with difficult conversations in a way that is productive and constructive rather than destructive. And that is what a therapist, that is what a healer does. And any professor, any educator, any coach, any therapist is a healer. And that's the most important thing, is being the difference between a constructive versus a destructive conversation about something that is inherently uncomfortable. Thank you.
Dr. Martin, thank you so much. And, you know, also starting off with your own, yeah, thank you. Just starting off with your own vulnerability, showing that we all have it. And for all the work that you do, it's so amazing to have fellow colleagues in the healthcare space that I can have full faith in and trust that, you know, I can send a loved one to you if they need help. And that, you know, it's hard out there, and to know that you're there is really amazing. And thanks for also diving into some of the science behind this and the neurobiology behind it. And you know, some of you guys might know this. What came to mind, because we're going to dive into the social media aspect moving forward, is there's a trend around dopamine checklists that some of your students might be doing, which is actually a healthier version, right? So it's people who are recognizing the impact that substances and social media is having and trying to create these checklists of things that bring them happy moments and dopamine spikes. So we'll dive into that as well, but just want to thank you again for giving us a little bit of that background, taking your time to come out here and really sharing your own story with us. So looking forward to the conversation moving forward. And I know we've been sitting down for a while, so we can all get up, stretch, take a break. We're actually going to cut it down to about a 5-minute break. But before we do that, why don't we take one question, if it's pressing, for Dr. Martin. I got one then. You've seen thousands, tens of thousands of families and patients come through the ER, through your clinic. What is there something that, how do I phrase this? Is there something that you would want to say to the caregiver that comes in?
So I tell patients all the time. Unfortunately, I deal with a lot of end-of-life care. And circling back around to answer your question, I tell patients all the time, I am so blessed to love every single day of what I do. I love what I do. If God himself came down and said, you can do anything with the wave of a wand, I'm doing it already. But I don't love your family like you do. You are allowed to be their family first. Let us be the healers. Let us be the caretakers. It's not that I don't want you to be a part of that decision-making process. I do. But I want you to have an opportunity to just be someone's husband, wife, son, daughter, parent, because that is the intimacy that you deserve and that they deserve to remember. And so when people are struggling, don't be afraid to engage in resources that you know that you trust, whether they're professional and mental health associated or whether they're community, whether it's faith-based. In the end, as long as you are comfortable, as long as you trust them, then that's what you should be looking for. But don't feel obligated to be everything to your loved one just because you want to help them. You're allowed to just be their family.
Do you guys hear a theme here this morning about that? We talked about it with Jason and Ashley as well. So you're not alone in this, and it's important to open up and get those resources.